everyone, and thank you for joining us today for our first ever Lunch and Learn session. My name is Georgia, my colleague Sam is also here, and we are the Aged Care Digital Health Consultants for Murray PHN. If you have any questions at the end of this Lunch and Learn, please feel free to email them through to agedcare@murrayphn.org.au. We'll start off today with an acknowledgement to country, if you would like to do that one, Sam.
I'd like to acknowledge that I am dialing in today from Jajal Wurrung country. Murray PHN acknowledges its catchment crosses over many unceded First Nations countries following the Dalkanya-Yaluk, the Healing River. We pay our respects and give thanks to the ancestors, elders and young people for their nurturing, protection and caregiving of these sacred lands and waterways, acknowledging their continuing cultural, spiritual and educational practices. We are grateful for the sharing of country and the renewal that country gives us. We acknowledge and express our sorrow that this sharing has come at a personal, spiritual and cultural cost to the well-being of First Nations peoples. We commit to addressing the injustices of colonisation across our catchment and to listening to the wisdom of First Nations communities who hold the knowledge to enable healing. We extend that respect to all Aboriginal and Torres Strait Islander peoples.
Thank you, Sam. And I'm dialing in from Wiradjuri country over here. So Murray PHN are part of the national network of 31 primary health networks across Australia. We work closely with the primary health system to identify opportunities to improve health outcomes in our community through better coordination and support of health services and by commissioning new services to address the health needs of our population. We help patients receive the right care in the right place at the right time. PHN strengthen primary healthcare through integration, coordination and capability building. We assist by redesigning healthcare systems and redeveloping models of care through transparent planning, ongoing engagement, collaboration, and resource allocation based on strong evaluation and evidence. PHNs are not-for-profit organisations funded predominantly by the Australian Government to tackle identified national objectives and local priority areas that include Aboriginal and Torres Strait Islander health, aged care, alcohol and drugs, child health, chronic disease, digital health, general practice, health workforce, mental health and population health. These priorities frame the work of Murray PHN, which is also guided by community and clinical input to improve health outcomes. Today we are going to be talking about the aged care schedule. PHNs have received funding to support the Australian Government's response to the Royal Commission into Aged Care Quality and Safety. The Royal Commission examined the complex issues being faced by senior Australians at the interface of the primary healthcare and aged care systems, such as a lack of access to general practitioners and allied health professionals in residential facilities, difficulties accessing after-hours services, and inappropriate transfers to hospitals, all of which contribute to poor outcomes for senior Australians and increased pressure on the health system. Residents can experience deterioration in their health during the after-hours period, but immediate transfer to hospital is not always clinically necessary. A lack of awareness and utilisation of after-hour services provided by GPs and other health professionals leads residents to unnecessary hospital presentations. Now I'm going to hand over back to Sam to discuss the PHN's telehealth project.
Thanks, Georgia. So under the aged care schedule, primary health networks have been provided funding to assist participating residential aged care facilities to have appropriate telehealth facilities to enable their residents to virtually consult with their healthcare professionals, to provide training to participating residential aged care facilities staff to support them to have the capabilities to assist their residents in accessing virtual care, to encourage increased risk of My Health Record by residential aged care facilities, which will help to improve the availability and secure transfer of residents' healthcare information, and to consult with jurisdictional authorities to ensure the initiative complements but does not duplicate efforts underway by the state and territory governments to improve technological interoperability between aged care and health services. Georgia, can you please move on to the next slide? So what we're doing with this funding, so first I'll mention we had some round one funding, which we released late last year. So the opportunity was for residential aged care facilities to send in an expression of interest to receive a telehealth card in addition to $5,000 funding. So the telehealth card included a 24-inch monitor, keyboard and mouse, HD examination camera, a Bluetooth pulse oximeter, blood pressure unit, infrared thermometer, a digital stethoscope, and 3-year subscription to vision software. And now, as part of round 2, this is currently open. So round 1 is now closed, but now we've opened this opportunity for $10,000 grants for residential aged care facilities in our catchment who did not apply for round 1 grants. So what this money is for is to enhance virtual access to care. So this could be done by getting hardware, so such as telehealth cards, laptops, tablets, any peripherals that could assist, to upgrade software, to improve IT infrastructure or enhance Wi-Fi. So this could be a completely new Wi-Fi provider. It could be improving the networks in your building. So anything that you can justify that would improve virtual access to care could be used. And there's about 15 spots available left for these grants, and they will remain open until all grant funds are allocated. I'll pass back to Georgia now, who's going to discuss after hours.
Thanks for that, Sam. So under the aged care schedule, PHNs have also been provided funding to provide guidance to assist participating facilities to have appropriate after hours plans in place, educate staff on the after hours healthcare options and processes for residents, encourage facilities to implement procedures for keeping residents' digital medical records up to date, particularly following an episode where after hours care was required, and support engagement between facilities and their residents' GPs and other relevant healthcare professionals as part of after hours action plan development. VIPNA, which is the Victorian Tasmanian PHN Alliance, came together in late 2022 to discuss the aged care schedule and agreed to co-design the development of an after hours toolkit for residential aged care facilities. Feedback was sought from RACF's Ambulance Victoria and local health networks, including Monash Health, Alfred Health and Peninsula Health, across the PHN regions to coordinate the development of an after-hours toolkit plan, with each PHN focusing on a different component, of which there were 5 in total. We'll go through the after-hours toolkit resources in more detail in our next Lunch and Learn session, which will be held in May. Murray PHN have also been working on a series of resources for residential facilities. Please note that these are still in development and we will have updates shortly for when these should become available. We are working on developing a mini webinar series on recognising early deterioration of a resident. Each module will include 3 learning objectives and 3 quiz questions, and each webinar will be 6 minutes long. After reaching out to some facilities in our catchment and through communities of practice events, as well as through consulting other PHNs within Victoria, we identified some gaps in available training, and that's how we decided which modules to cover in this series. These modules have been requested by facilities with both clinical and non-clinical modules available, so all staff within an aged care facility will be able to participate in this training. The other feedback we received from you was around time constraints for staff to be able to participate in training, which is why we decided on the 6-minute webinars. There's going to be a 2-minute introductory scenario to the cases, which will be a woman in her 60s, First Nations and metabolic, a Mandarin-speaking man suffering from falls and frailty, and an English-speaking woman with dementia. The other modules include Advanced Care Directive, Cultural Safety, performing an acute assessment of a deteriorating resident, identifying symptoms that require immediate action, eating, drinking and elimination, communication, movement and mobility, skin, breathing, mental awareness, end of life, a tick sheet on how to recognise deterioration, head-to-toe assessment, how to handle dementia aggression, pain assessment, challenging behaviours in the after hours, education on ISPA and palliative care. Some additional resources that we're also working on. An education and training program is being developed by VIPNA, which is the Victorian Tasmanian PHN Alliance, for use by RACFs using the range of different telehealth options. The training program will be collectively developed, then delivered locally by each PHN. The education will be aimed at 3 target audiences: the patient end, clinical end, and family end. The other resource that Murray PHN are working on developing is cultural safety training. Recommendations from the Royal Commission into Aged Care Quality and Safety emphasise the right of all Aboriginal and Torres Strait Islander peoples to receive culturally safe aged care services, and a requirement for all aged care employees to undertake regular cultural safety training. These recommendations are consistent with the requirements of the Aged Care Quality Standards and the new Code of Conduct for Aged Care. To support residential aged care facilities to meet these requirements, Murray PHN has partnered with Gowanda Education to deliver online cultural safety and First Nations health training, available at no cost to aged care employees. Gowanda Education is First Nations owned and managed and privileges Aboriginal and Torres Strait Islander voices in co-creating decolonised spaces of new knowledge, insight and understanding. It develops online training to ensure learning outcomes and accreditation requirements are realised in educating health professionals and service providers with the capacity to provide and progress culturally safe ways of working. Murray PHN will be in contact with more details soon on all the available training. Many residential aged care home residents are now eligible for the 2023 COVID-19 booster dose to help protect against severe illness. The Commonwealth Department of Health and Aged Care have requested that Murray PHN contact each home in our catchment to determine whether you need assistance from primary care to access the vaccines. Please contact our primary health response team at covax@murrayphn.org.au if you need help to coordinate with a local primary care vaccine provider to deliver in reach clinics. So please feel free to email through any questions that you may have in regards to today's lunch and learn session to agedcare@murrayphn.org.au. Either Sam or myself will respond very shortly. And thank you very much for dialing in today.
Thank you, everyone.